Thank you, Dr. Koh. Good afternoon, everyone. Region 4 is proud and pleased to serve as a co-host for this month's Leading Health Indicator webinar, especially since it features our colleagues and friends at the Department for Public Health in Kentucky and their Healthy Babies Are Worth the Wait program. Anyone who's ever held a healthy baby knows that when that new baby is placed in that mother's arms, all of the challenges, obstacles, and struggles of the previous 9 months fade into the background. And all she sees is that precious, beautiful life in front of her. And at that moment, not only does that mother know that it was worth the wait, but that mother also knows it was worth all of the other things she overcame. But when a baby is born too soon or too small and suffers life-threatening complications, the impact that has on an entire family can be devastating. Region 4 is a family. We comprise 8 states: Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. And we are not immune to problems. We are the largest geographic region with 61 million people. We are most impacted by health disparities. We have the highest ethnic and racial diversity. We have the most poverty and the highest illiteracy rate of any other region. 30% of us are obese, and we are home to 18% of the nation's homeless. We also have the most extremely preterm births and carry the unfair and heavy burden of infant mortality for the entire nation. But I can assure you that since moving here in 2007, I have never met more committed and caring people at both the state and community levels who are determined to work together to improve the health of their families and their communities. Just 2 months ago, in January 2012, state health officials, maternal and child health directors, and state partners from across Regions 4 and 6 met to share ideas, strategies, and resources to address infant mortality. They talked about implementing state policy changes that would eliminate elective deliveries prior to 39 weeks gestation. They talked about improving access to care for all women of reproductive age, including providing progesterone therapy for those with a clinical indication. They talked about developing and implementing a regional campaign to address other aspects of women's health, like smoking cessation, chronic conditions, and influenza immunizations that impact a pregnancy. And they talked about promoting safe sleep for babies. These ideas were shared because they have worked for some states, and they may carry promise for others. There are also many local efforts in counties and communities throughout the region. Together, Region 4 is addressing this issue as a family. And today, you'll hear about one of our success stories with the hopes of inspiring you to take action. I am now pleased to introduce to you my friend and colleague, Dr. Ruth Shepherd, the Director of the Division of Maternal and Child Health at the Kentucky Department for Public Health. Dr. Shepherd?
Thank you, Sharon, for those beautiful and inspiring words, and welcome to all of you on the webinar. Now we're going to take a look at an example of how communities can take action in order to affect those maternal and child health indicators. We are pleased to share with you Kentucky's experience with Healthy Babies Are Worth the Wait, a community-based approach to prematurity prevention that was developed and piloted in Kentucky from 2007 to 2009. As you heard from Dr. Koh, the problem of prematurity is a major issue for public health and particularly maternal and child health. And as we heard so eloquently from Sharon, it impacts infants, their families, and the communities we live in. It is about our future. Prematurity is the leading cause of infant mortality, and in addition, it is a major cause of lifelong problems. Prematurity is associated with over half of all the neurodevelopmental disability, such as cerebral palsy and mental retardation, as well as less severe disabilities such as learning problems and behavior problems. We now know that there is increased risk for these problems, not just in the babies who are born extremely preterm, but even in babies born just a few weeks before their due date. Chronic disease impairs many adults, and there's now a lot of national discussion about how to prevent chronic disease, but many studies now have documented that the risk of developing those chronic diseases may even begin before birth, the fetal origins of disease. Preterm birth has been linked to increased risk for chronic diseases in adulthood, such as heart disease, obesity, diabetes, and others. And so prematurity prevention may be one of the first steps in reducing the overall burden of chronic disease. All these things make the recent rise in preterm birth in the U.S. even more concerning from a public health perspective. Over the last 2.5 decades, the rate of preterm birth has risen by almost 30% in the United States. So in the Healthy Babies Are Worth the Wait initiative, we approach prematurity as a public health problem, not just a medical issue. After all, prematurity can happen to anyone. You can do everything right and still have a preterm birth. Prematurity is so common that virtually everyone knows someone who has had a premature baby, and that makes it a topic that really engages people, and they have an immediate interest in prevention. It's because of that high prevalence from a public health standpoint that prematurity is statistically an easier measure to track and monitor changes than infant mortality. But like infant mortality, it serves as an important summary indicator that reflects the social, political, healthcare delivery, and outcomes for a geographic area. So as we work to improve systems of care and support directed towards prematurity prevention, it should also improve infant mortality and should result in savings not just in healthcare costs, but also the emotional, social, and financial costs to families and to communities. And while there are certainly opportunities to improve the dissemination of evidence-based practices in the healthcare arena, preventing preterm birth goes beyond what happens in the healthcare provider office or hospital. To reduce preterm birth and eliminate disparities, like with other public health problems, we need to take the more comprehensive approach that includes the multiple determinants of health.